Erin. Okay, so I'm Shauna Sandberg again. And so as Erin laid out, this sort of is the overview of the process. So right now we're going to sort of focus on eliciting what's important from the patient and setting a goal. And this is probably, depending on your position, but probably something you're somewhat familiar with, talking to patients about what's important to them. I think the 4 organizations who are participating already have some familiarity and interest with sort of meeting patients where they're at and finding out what's important to them, doing motivational interviewing. So I think you'll find that a lot of this sounds familiar, but there's a couple of certain pieces that we put in to make it sort of a standardized process. So we started off by talking about what's a goal and sharing some of our goals, but when we say goal, we really mean an aim or a desired result. And I think, you'll find if we were all asked at the beginning, think about a goal that you set for yourself and that you met, and your mind immediately goes to these lofty life goals, like when I sat down to write my dissertation, and so we realize that terminology even can be sometimes off-putting to patients, and so sometimes it's up to you how you want to describe this process to patients, but it's sort of a process of asking them about what's important to you, where do you want to get to, is there some kind of outcome you want to get to, and not necessarily think it could be lofty, and that's fine, but it could also be starting small, like a lot of us share things. But the key is that we need to understand what's most important to that individual in order to be able to set the goal. And then as we mentioned, SMART goals, and you may be familiar with this acronym, but setting a SMART goal means that you take something that's important to someone, and they may not verbalize it as a SMART goal, they probably won't, but something important to them. I want to spend more time with my grandchildren, that's important to me. And then you start a process of talking through it with them, and together you can make it something more specific. So as Erin was talking about, how will we know if this actually gets achieved? We want to make it something specific enough and something that we can measure, so that the individual knows how they're defining their progress and what good means, and that the provider does, and that this is a shared understanding. Third, we want to focus on things that are attainable and achievable. So making the goal realistic, and this is sometimes involves a conversation with the patient. Patients often want to sort of push themselves and achieve something lofty, but sometimes it's a process of talking through what's sort of realistic to start with and sort of gaining experience with it, but then you can move on to the next step. Keeping it relevant to the individual, certainly, as Erin was talking about, A1Cs is a very important health goal for many patients, but not necessarily what's important to them. And so making it relevant to the patient, and time limited, setting a time frame, because we all know if it's just my goal to do this someday, it's probably less likely to happen, and there's not a way to sort of measure if you when you got there. So again, one of the phrases we like to use is eliciting what's important to someone instead of what's important for someone. And in healthcare, there are lots of goals made for people. Sometimes care management programs automatically generate certain goals for patients based on their risk factors, but this is a really sort of different way of thinking about goals. And frankly, when you start engaging in somewhat the conversation, it can be kind of difficult, because sometimes people have never been asked what's important to them. They're used to coming, see their provider, hear what I need to do, and then go home and either do it or not. Right. And certainly individuals, so this is all about tailoring things to an individual. So people have differing levels of disability per se. Not everyone can be able to set the same kind of physical activity goal. Differing needs and supports. And one thing we heard from the pilot was that this was helpful in setting a goal, and even if someone didn't achieve the goal immediately, identifying those barriers and what supports could be helped was part of the value of this process. There's expectations of the individual or the caregivers, and expectations from the provider too that can also influence how people set goals. And people do tend to set goals depending on who they're talking, different kind of goals depending on who they're talking to. But to the extent that you can make this process a sort of, sit down together, we're on the same page here. You may be used to me telling you what to do, but this is your chance to tell me what's important to you. So we have some ideas, and have a toolkit that's in your big packet of materials. Yeah, and
Big packet.
on page 16, there's some just ideas for conversation starters if you have trouble getting started. Just like I said, you don't have to say, so what's your goal? Because that can be kind of off-putting or anxiety producing for some people. But what would it mean to say you're doing well? What does a good day look like for you? How could we try to increase the number of good days? What does a bad day look like? What needs to be in place for you to have a good day? When did you last feel that way? Let's talk about that and what was going on at the time. Is there anything in your life you'd like to change that could help you get closer to doing well? One of the care managers I remember in our pilot would say, what would be sort of the life changer for you if this one thing could change? How do you see things getting better? And it could be, again, in terms of health, and a lot of people naturally talking to a healthcare provider think about health, but it could also have to do with their social well-being or getting out of the house more, and we all know how that actually is very important to someone's physical health as well, and or other ways. We don't have to limit it to one particular area. In terms of working with caregivers, there may be some cases where you're working with a caregiver primarily because this is a conversation and maybe the patient isn't in a place where they can have that conversation, and so you may be working with a caregiver or perhaps a person who's sort of taken over as a proxy for the patient. And in that case, you can really encourage whatever is important to that caregiver, and sometimes it will be setting a goal for their patient, just as we talked about setting goals and helping our children achieve certain goals. So in the pilot, we had some caregivers who wanted to help the person they were caring for stop losing weight or slow the rate of weight loss, or to set a goal of helping their loved one adjust to this new nursing home environment and get more involved in group activities. But caregivers can also set goals for themselves, as we know. Caregivers don't often take care of themselves when they're busy and concerned with taking care of someone else. So we also had caregivers in the pilot set goals for themselves, like improve their eating habits, just have more fun, take time to get out and exercise or do some social activity. Or for one person, something that was really important was find someone who could fill in so that the caregiver could get a break once in a while. Yeah, and so that can be really powerful. Sometimes, again, with the caregiver, no one's actually asked them what's important to them because a lot of the focus has been on the person they're caring for. So just so that you can see, there is a wide range of goals that we ended up collecting in the pilot. Some were very healthcare oriented, and that's fine. Avoid hospitalizations for the next 6 months, get off oxygen, and things like that. But others were more social. Attend one lunch and one social activity at a new residence. Identify someone who can stay with the patient when the caregiver needs their own time, go to the pool with the daughter, practice faith. We also found spirituality and faith was a large domain that was important to a lot of patients, and it may not be something that always gets brought up in a healthcare setting, but if that's something that's important to their patient, then you can work with that goal and you can kind of take it in different directions. If it's about having the physical strength to be able to get out of the house, or if it's about that connection with the higher power.
If I could just interject here for 1 second. I think that's one of the things that we heard a lot from the pilot, the people that were in the pilot about this saying, and this is probably, you guys probably all know this, but that there may be things that you want someone to do because it's gonna help them in the long run, PT, OT, taking medications, and trying to tie that's not the goal, right? The goal for them, they don't want a goal to be, I'm gonna go to PT. The goal is I'm gonna be able to get to church, and to try to then use that as a goal to motivate them sometimes to do the health things that are what's going to help them. And so when we talk about the goals that we're looking at here, we really do want them to be the goals that the individual is setting, but that doesn't mean that the plan to achieve those goals can't involve healthcare interventions. And that's what we saw a lot of, as people setting goals that you would look at and you say, well, that's got nothing to do with healthcare, but it actually does, because in order to achieve those goals, they needed to achieve something related to their healthcare to make that happen.
Yeah. The other thing we heard sometimes too was that starting with a small goal that was perhaps not so closely aligned with health, and then working with the patient on that, and the patient having that experience of seeing they could achieve that, and this person, and you're building that relationship with the patient too, and this person is helping me do something that I want to do now. Maybe I can give back and do some of those things that they suggested to me about going to physical therapy and stuff too, that it helps with sort of relationship building and trust, and this kind of buy-in that we're in this together.
I mean, just one last example, which is that I don't know the degree to which you guys work with patients who are near end of life, but we've had a lot of different people come through this that were there working with people who were near end of life. And of course, they're not necessarily working towards achieving any sort of health or improved health, but it was about getting themselves to a good mind, a frame of mind, and about quality of life. And so, we had somebody who, it was putting together a slideshow presentation of her trip to Africa she did when she was younger for her assisted living. And that really helped her to feel like she had some purpose. And that patient did actually pass away, but it was, the social worker that was working with her felt this was actually really valuable. This helped her to be at a state where she felt like she had purpose at the end of her life.
So how did the healthcare team get that goal, help her get that goal accomplished?
So the social worker that was working with her, some of it was just kind of coaching on, well, what are the steps you would need to take to get a slideshow presentation together? What are your fears? Some of her fears was that she wouldn't have the stamina to stand, to present. Where they talked about, okay, what are the things we can do to help you with that fear, and that she would be so far declined that she would not be able to. And some of it was just kind of coaching on, what are your fears, and how can we figure out what are possible solutions to that? So that was what that particular social worker did with that person. And she did her presentation and was very successful, and actually used part of it to include in her memoirs that she was trying to write towards the end of her life. So. And this was someone who, at the beginning, when the social worker started working with her, said basically, I'm going to die, I'm not doing anything. Don't ask me to do anything, and she was like, I'm just waiting to die. And this, was really helping to put her in a better place.
So we have built into the app what we call the patient goal inventory, and there's also one for a caregiver goal inventory too. And it's the items in it are spelled out on page 47 and 48 of the toolkit, but basically it's if you need it. So you can either engage in conversation, or if you're working with an established patient and you kind of feel like you can, through a conversation, zero in on what's important for them, this is optional, you don't need to use this. But if it's a new patient or someone that you're not really sure where what matters to them lies, you can sort of walk through this with them. Like, here are some sort of general goals, and then you can make it more specific, but let's pick 3 areas that might be things you want to work on in your life. So there are, and these are built on the common things that we heard in the pilot. So stay out of the hospital or emergency department. Some people are really focused on, there's a specific service that they need that's going to enable these other things. So those are in there, but then also be physically active, care for myself, do recreational things, report accidents, socialize.
I have a question.
Yes.
So if someone doesn't think of their own if someone doesn't come up with a personal goal and we show them this list, like how effective is it if they look at like, oh well I'll just do that one? Like that doesn't seem like it would work that well because they might just pick something because they feel like they have to but not be engaged.
Yeah. So not everybody gets engaged in this process. That's just, everybody's different. And we're fully accepting that there's going to be some people that either going to flat out say, no, I don't want to do that, which is fine. We just asked you to record. They said no. And that's part of what we're going to be learning through this is who are the people that say no. And there's going to be some people that may do it and they're not necessarily engaged in it. What we've done, in the past, and you have paper copies of these as well, is talking to people about, what we want, and we have some language in the toolkit about how you introduce this, but basically saying, I want to help you achieve what matters most to you. And in order for me to help you do that, I need to know kind of what are your priorities. And here's a list of some priorities that people have. And, could you help identify for me, are there any things on here that are really important to you or things that you really want to be working on right now? And sometimes people will say, no, none of these, I'm fine. In which case, sometimes you have to change the discussion to, okay, well, is there anything you want to make sure you can maintain right now? Because sometimes people don't have, they're fine. They're like, I don't want to achieve anything. So then it becomes about, okay, well, what's most important to you to keep the same right now? You're doing really well, you're living in your house. You want to keep living in your house, and that may be a goal, is just to stay someplace.
I think our for me at least, the biggest challenge is sometimes the patient's goals are not in alignment with what the caregiver wants. We run up against this all the time that, a daughter or a son or a spouse has very specific things they want that patient to accomplish, and the patient may not be like, that's not important to me, I would rather.
Yeah.
So in that case, how do we work around, I know this is supposed to be patient-centered, but is that an opportunity perhaps to set both, as long as they're kind of in alignment, caregiver and patient goals?
Yeah, the system isn't set up to have two different goals right now. There is you'll see that, and if you go to the toolkit, you can see the full thing. The caregiver one is aligned with the patient one, so that they use the same language. It's just slight, different perspectives, and so that could be a tool in which you use to say, are there areas we can agree upon? We want to keep you out of the hospital. That's something we can agree upon, so that could be a good goal. I think that setting, that's, you guys know that I don't have a magic solution for resolving the challenges of family, but I think that trying to find a goal that it's important to the patient that the family can at least be on board with is really critical, because if you have that conflict, it's just going to be really hard to achieve those goals. If it's not a goal the patient wants to achieve, or if it's a goal the patient wants but the family says, well, I'm not going to help support that. It's you've set yourself up for not working there.
And yeah, the other thing I would say about sort of a patient just kind of choosing a couple at random is that you can choose a couple and then you ask them to sort of to pick to one. I don't know if that's the next slide. So when you select them, they get listed out, and then you select one of them to really focus on. And so that can be maybe the conversation where, is one more important to you than the other? And the other option that's always there, even on the previous screen, if you at the top, is just to add a custom goal. So like, none of these things appeal to me. What is really important to me is X, and you just put in their own words. And then even with the sort of the goals that we've put in there, those can also be customizable. So it's, it's in words like increase physical activity, but you could actually change that to swim, once a week or that.
I have another question. You might be getting to this later, but what if someone has a goal that is very unrealistic? Like sometimes we have patients who have a degenerative disease, but they want to walk again, and we know that it's not going to happen. So is it in this project, is it appropriate to allow people to work on goals that we know they won't be able to achieve, or would you prefer that we try to coach them into maybe a smaller goal that is more realistic?
Yeah, so I think one of the things, if you go back to that SMART algorithm, the attainable is a really important part. So we do want these to be goals that the person thinks they can actually achieve, and that you think that they can actually achieve.
Okay.
And we'll talk a little bit about rating the difficulty of goals, because we do have a section where we ask both the patient and you separately to rate the difficulty of the goal. So a patient may say, this is gonna be easy, I'm gonna walk again in a month, and you're like, no way. So that, we're gonna collect that data. I think that, and we talk a little, there's some things in the toolkit actually about patients setting unrealistic goals, and sometimes it's about taking the goal and saying, well, you wanna walk again, okay, well, why is it that walking is so important to you? What is it that you would achieve by being able to walk again? And are there other things that we can do to help you get to the same place that isn't necessarily gonna be the thing that you can achieve, like walking again? I think the other one we hear a lot is driving. You know,
Yeah,
I wanna
get my thoughts out too. We're like,
and that's a really tough, conversation to have, but it's about, okay, I'm not sure that may be the thing that we can achieve, but what is it about driving? What is it that you wanna be able to do, and can we help find solutions to help get you to the things you wanna get to that don't involve you needing to get your license back? It's really tough.
yeah.
I mean, there's no
And
magic
especially
here.
in the driving, I feel like we'll probably have some patients who are like, nope, I don't believe you, I'm gonna drive again. So you may just see some of those in here.
That's what I would say, that even
There'll be
if you
some
try the
outliers.
coaching and you're, and you try to have that conversation, and some patients just refuse, like, this is my goal, then, we do see people putting that in because we're
Yeah.
getting
I have
in
a question too, and maybe this is something that we need to talk about at a different time, but how are we defining a caregiver? Is it,
Excellent. So we're letting you define who the caregiver
doesn't
is.
have to be a power of
Yeah, it
attorney,
doesn't.
none of that,
No.
business love that.
It's
That's
however you would define as, I'm working with this person and this is the caregiver, and it can change.
great.
Because we know that, one day they show up with this person, and the next day they show up with another person,
Yeah.
and it's like, okay, well, today the caregiver is this person. So.
Okay, great, it's helpful.
Can I ask a clarifying
Yeah.
question? It's kind of like Alzheimer's
Yeah,
disease.
please.
So you're saying that they can list a lot of goals, but they have to pick, does the system allow you to list more than 3 goals? And
Let me show you. That's an excellent segue. So I'm gonna demonstrate this, and then we're gonna have each of you, so you may wanna start logging back into your iPads with that complicated password, because we're gonna have you then actually practice this.
Need to open the lid.
So one thing about the app is that for HIPAA compliance reasons, it will lock you out after 15 minutes of inactivity. So the iPads are also set up, I think right now, they're still on the default, which is 2 minutes they shut up. You can change that to be 15 minutes, so you don't have to log into the iPad as well.
Sounds good.
All right, so I'm just gonna have folks select test MedStar, or the first person you have on that list of patients. I'll just show you how this works. So the first thing you're gonna do is, if this was a person that we preloaded information for, you would see some of the basic things about them, their name, their date of birth, age, gender, and language. We have this, is anybody here a Spanish speaker? Okay, then you won't need to worry about it, but if there is, this comes in Spanish as well. We'll come back to this background information piece, but that's where you could put in more. So you hit this nice big button, that's the blue button that says start. So the very first question is about who are you working with today? Is this a patient? Is this a caregiver? Is this a patient and a caregiver together? Is this a caregiver speaking for the patient? So the difference here is that this could be that you have 2 people coming in together and you're working with them together, versus you have 2 people coming in but the caregiver is really the speaking for the patient. Or other, if there's some other situation we haven't thought of, you could just put that in.
and you're allowed, I think, to write in.
Yeah, if you do other,
Like,
just write that in.
Whatever
So
it is.
should we pick whichever one we
You
want
can just,
right now?
you can pick whichever one, or you can not select anything, I'm just walking you through this,
Oh,
so you can
okay,
show,
gotcha.
none of these questions are required. So, well, let me put this back. We'd like you to answer all these questions, but the app doesn't force you to answer things before you can move to the next screen. So you don't need to select anything right now, you can just, this is just for demonstration. So the next question is just, and this is really for our research purposes, but where is this taking place? Home, phone, clinical office?
Can we do this by phone?
Yes.
Okay.
So the next step is in the bottom, you're gonna continue to the goal inventory. So here you can see there are two versions of the goal inventory, like we talked about, patient and caregiver. Here's the caregiver one. And so this allows you to, you can scroll down, so the first few goals here are really the same patient goals, but from the caregiver's perspective of I wanna keep the person I care for out of the hospital or emergency department. But at the bottom, we have goals that may be specific to the person, like minimize family conflict, have more free time for myself, receive support with caregiving. You can also, sometimes people already have a goal you're working on with them. You could use that goal for this. You don't have to set a whole new goal. So we've had some places where they already have goals in their care plan, and you can just add a custom goal and type in whatever goal you want. If for some reason you've decided that you saw the caregiver one, but you want to switch back, or you're impatient, you want to switch back, right up here you can switch inventory type, and you can go back. So you could select patient instead if you wanted to show them this. So I'm just going to, for example, just pick 3, and when I pick them, they show up top here. If I picked something and I want to make it go away, I'm going to click on that little red button, and it'll go away. So you can just add and delete as you want. So I get 3 that I like. You don't have to select 3. You can select 1. If people are able to zero in on 1, that's fine. Sometimes they need help. So they pick 5 things, and you're like, let's pick the top 3. This question, if you hit continue then, is going to say, okay, now let's just pick 1 that we're going to focus on right now. We can put these other ones as other things we're going to focus on. And so I've picked 1, care for myself. And now I've got also the opportunity to make this really specific. So this goal, because we wanted to not list 50,000, well, we originally started with a goal inventory that had about 35 items on it, and everyone said that was too long. People couldn't read 35 things. So there's fewer items, but they tend to be more broad, like care for myself, which can include a lot of things. And so this goal you'd probably want to take and say, well, what does that mean to you, care for yourself? Is it really about being able to do your own cooking? And so you just say here, care for myself, and make it into, be able to cook my own meals. And you can customize it however you want. So that's as far as we're gonna go, what I'm gonna have you do. And so the other things you can do is you can just back up at all times in this. Just back up to the beginning,
Cancel.
in that very top. You just go back. Now if you go back, the answers that you put in previously will be in there, but when you go in again, it'll overwrite whatever you put in. Okay? The first thing I wanted to just do is, how did that go for people setting goals? Did everyone get to a good goal that they felt like was individualized? Okay. I think one of the questions, we had Alana raised is, well, what happens to those, you may have prioritized 3 things and then, you only picked 1, Is there a way to work on multiple goals at the same time? If someone has multiple goals, is there a way to come back to those? The system is only set up to be measuring 1 goal at a time. So you're only ever working on 1 goal at a time. And that is intentional because we really want this to be prioritized by the person. So they may have multiple goals, but you want them in some ways to indicate this is the one that's most important, because we need to know which one we should be focused on for measurement. And sometimes when you have too many goals, people then change their mind. Those 3 goals that you set, those are actually gonna be recorded in the encounter information that you can go back and put into the record. So if they set if they had 3 different goals and you wanna include those in your records, that's gonna be captured, so you can include it in your record. The other thing that's gonna happen is that the goal setting, what we've learned, takes practice for both providers and patients. They may not set the right goal at first, which is why when you come back, and we'll talk about this in the follow-up, you can change the goal. You can say, I set this goal, you come back, you talk to them 2-3 months later, this wasn't the right goal, I've done something different. You can change the goal.
It's not a failure.
It's not a failure. And in fact, when we talked to a lot of patients in the last time we did this, they would say, I didn't meet my goal, but it was actually really good because when they came back and they asked me about that goal, I realized, well, I didn't really want to be doing this. I wanted to be doing this.
Cool.
And that helped them get to a better goal. And so one of our research aims in this is actually to, when we look, you remember all those outcomes that I had listed? I have a hypothesis that actually those outcomes will improve just by doing goal setting and measuring and revising the goals, not necessarily that you need to achieve the goals to get the benefit out of this. I think that the process in and of itself has enough value to improve outcomes.
And a lot of the goals kind of are interlinked. So, even though you may have not accomplished the one goal, maybe the other 2 that are on that list, you may have partially already met. So if they say, well, I want to focus more on that, you move that up to the priority, you may already be halfway through reaching that.
Exactly.
Because they're not mutually exclusive of one another, so.
Yeah. So we don't, what we found is that with a lot of patients, you do have to kind of go through this process. You have to come back and revise and get to the right goal for that person. Which is why we are recommending that at a minimum you talk to people every 3 months. So following people for 6 months, they should be talk to them at 3 months and then at 6 months, and that gives them the opportunity to say, because what we are looking for is how many people achieve their goal in that 6-month period. So if they come at 3 months and they say, that wasn't the right goal, you've got a chance to set a different goal and see if you can achieve that goal. We've put 3 months on these goals of what can be accomplished in 3 months. We started with 6 months. That was too long for a lot of people. It needed to be shorter. If you have a practice where you're talking to people every month or for whatever reason you're seeing them more frequently, you can do that follow-up and you can check in more frequently. And people could say, I achieved that goal in 1 month. And then you set a new goal and you try to just work towards something new.
Does the system have a way to flag us when 3 months has passed for certain patients in our list?
It has a way to run a report to show you that.
Okay.
We don't have a notification system, but we'll show you a little bit about the reports.
Okay.